welcome to the 6th Annual Nash Cares Community Education Series event, a panel discussion on gender-affirming care and mental health. My name is Robin Wagner, and my pronouns are she, her. I am the Burt Nash Center's Inclusion, Diversity, Equity, and Belonging Manager, and will be the moderator for tonight's panel. Before we begin, though, there are just a few housekeeping announcements I need to make. I want to begin by thanking the Lawrence Public Library for agreeing to be our host this evening, as well as Mayor Trust Credit Union for their continued support for this panel series. I would also like to thank each one of our panelists for sharing their personal experience on tonight's topic and taking the time out of their very busy schedules to be here. This truly is just the beginning of this work, and we at the Burt Nash Center are excited to have you all here to be a part of this community conversation. I am a firm believer that gender-affirming care is suicide prevention. I'm grateful for the advocates inside and outside of this room who worked to ensure that Governor Laura Kelly's veto on SB 233, a bill that would ban access to health care for trans youth, was sustained on Monday. Before we begin with the question portion of this evening, I would like to ask that each one of our panelists share their name, their pronouns, where they work, and why they feel this topic is important. So, Tori, if you want to start.
So I'm Tori Gleason, excuse me, she, her pronouns. I work at LMH Health and I'm a clinical analyst there. Why that's important to me, it's just, this is my community. These are my people, and these are my people out here. And so showing up and being present for conversations, to listen, to engage is really important to me.
Hi, I'm Jay Pryor, and I work for Jay Pryor Consulting. And my pronouns are, I prefer if you use all of them in a different, like all in one paragraph. I want you to go, she, he, they, she, he, they, she, he, they. It takes practice, but you can do it. So I like all the pronouns. And gender-affirming care, this topic, well, there's, just like you said, gender-affirming care is suicide prevention. I've lost too many friends and had lost too many brothers and sisters, siblings, they, thems, all of them, to people who couldn't access gender-affirming care and or who would start down that path of gender-affirming care and then be denied gender-affirming care or not be able to afford gender-affirming care. So I've been on the front lines of this for a really long time, and I'm delighted that we're actually having some real dialogue about it. So thank you for being here.
My name is Dr. A.J. Strickland. I'm a family medicine physician and addiction medicine specialist. My pronouns are he, him. And the main reason that I'm here today is that I'm an evidence-based physician, and I take care of patients no matter what their gender is or what their social background is or what their medical problems are. And when I started serving the Lawrence community, it's coming up on almost 10 years ago, I had a lot of young gender-diverse folks come in to see me who just needed medical care, and it became one of my favorite things to do, and so it's a big part of my practice, but is still just part of taking care of people, and that's what I'm here to do.
Hello, everybody. My name is A.J. Rain. No relation. I take the beard, but I use he, him, his pronouns. I'm a therapist at Burt Nash, and I'm here because I love everyone. We shouldn't have to have special discussions or special programs, but the systems that are in place require that we give this kind of attention. I'm very grateful to be a part of that conversation.
Howdy folks, my name's DC, my pronouns are they or he, and I am an attorney with the ACLU of Kansas, and I focus on queer and trans advocacy in our state. And I like to say I'm a fun attorney. I'm not in the court as much as you think of traditional attorneys. I like to do a lot of work in the community and a lot of work in the policy space. And so very thankful I want to just uplift again that we killed that bill, and so thankful to the folks in this room and everyone who put work into stopping that, because my work as a civil rights attorney upholding queer and trans, Kansan civil rights is really, I think, rooted in making a space in Kansas for queer and trans folks to live joyful, full lives. And you can't do that without being healthy and access to mental and medical health care that are life-giving and medically necessary. And so that's kind of the role I see my work having here.
Perfect, thank you all. So I have a few questions just to get the conversation started, and then we'll open it up for audience questions. So, Dr. Strickland, can you tell the audience what gender affirming care entails on both the physical health side of it and the mental health side as well?
Yes, absolutely. So gender affirming care is kind of an umbrella term when really what we're talking about here, at least in the medical space, is talking about a full spectrum of health care that just includes regular routine primary care for folks that includes their gender identity, the knowledge of that, which can impact your health care in all kinds of ways. And it doesn't take any kind of special physician or training necessarily to start doing that. Then we also have the kind of care that most people are thinking of are like hormones, types of medicines that help bodies reflect gender identity. That is largely like estrogen or testosterone, ways of making the body have characteristics that are in line with that person's gender identity and gender expression. Also on that spectrum would be gender affirming surgeries. This is again more medical interventions that help the body reflect that gender identity, as well as mental health care that is also informed by gender diverse experiences. That is in no way a comprehensive view of everything that includes. Every kind of medication that changes or helps the body reflect those things. And I'm not necessarily just talking about transgender health in that sense, which is important to keep in mind as well. Everybody does some degree of gender affirming care, even folks who are cisgendered or not trans, do things that help their body align with their gender identity, whether that's something simple like removing hair from parts of their bodies that are culturally assigned, as opposed to taking medications to prolong non-menopausal states or prevent going into menopause, right? All these things are ways that we help our body reflect who we are and live a helpful, or live a happy, disease-free physical state that reflects who we are and what we want to do with our lives. And so there's a lot of different ways that we can do that, but in general, the important idea behind that is just to keep an open mind to what that actually means and that it does impact everyone, not just the trans community. It affects everyone, so yeah.
Perfect, thank you. DC, what are some of the most effective methods for advancing social justice for the LGBTQIA+ community? And anybody can jump in after DC as well.
Yeah, I welcome my fellow panelists too, because I think y'all have all been doing lots of advocacy on this space for longer than me. But I want to say that, from my perspective at the ACLU and the work we do, I think it's so important that we have engagement at the community level with these issues. And I think LGBTQ advocacy can look like a lot of things. I think it sounds really formal, but it can be as small as, interpersonal conversations where you are, helping people understand gender-neutral pronouns, or talking to coworkers about concepts that they may not have as much competency on that you do have competency on. Or looking like, does your workplace have a gender-neutral restroom? And if not, have you ever asked management about the options? Or like small things. Things like that is LGBTQ advocacy, and it does make the state that we live in more welcoming for queer and trans folks here. But then I think there's like bigger collective action, like what we just saw happen with SB 233 and the action we saw across the state to oppose that bill. And I think that the win that we just saw happen on that healthcare ban only happened because we had people from every part of our state, and not just queer and trans people from every part of our state, but we had people, in the mental health profession, in the medical health profession, in the education space, state employees reaching out that were not you know, it was not only trans people doing this, but it was a collective action, and I think that's important, you know, thinking about what you can do, whether you're in the community or not, to further the goalposts of making Kansas the state that we want it to be. You know, as far as specific action, like find a political home, you know, whether that is the ACLU or whether you have, you know, a church that you feel really welcome in or some other local organizing group that you can stay apprised of the action in your community and in your state and stay involved. I think that's really important because we know that these battles are not over. This is going to be a long fight, and I think getting involved now and finding a place where you feel like you can do advocacy long term is really important. But I welcome my other panelists to chime in. If y'all want.
Jay, you recently did a training for the Burt Nash Center,
I did.
and you mentioned some numbers related to the impact gender affirming care has on the youth. Could you talk about those numbers and the impact it has?
Do you want me to tell you slides that I don't have in front of me? But sure. Well, first of all, I think it's important to note that one of the things I always share is that GLSEN, and that's glsen.org, has done a climate survey in every state since 1990. So we're talking data all the way back to 90, and they've done one every other year. So the most recent one that is, and 2023 might be, like I should look, because it might be out. But I was quoting from the 2021 survey and first it was from the climate schools, and that was, you know, mostly stats on the fact that at least 80% of our kids in Kansas schools hear gender slurs from teachers, from staff. There's a level of, I think, 27% of them experience physical violence in our schools. I mean, those are some of the statistics, and I invite you all to go to GLSEN, and if you love research, you could be there. You'll go down a wormhole. You'll be there for days. But the most staggering statistic, I think, is the one that was done by the University of Texas Austin study in 2022 that gives us a different stat on being able to affirm the name of a youth. Between 15 and 21 youths that are able to use their name that they prefer, the genders, and have people affirm their pronouns, have a 67% decrease in suicide attempts. 67%. I mean, it used to be, I've been doing this work a long time, and we used to say that if we called the kiddo by the right name and pronoun, we reduced suicidal ideation in half. But this statistic is more new, and it kind of blew my hair back a little bit. And at the same time, I'm not surprised. Just being that world of affirming us, and especially those of us that are under 12 and under 16, by the right pronoun and name really is about being seen. And you all understand, I'm sure, how important it is to be seen as a human being. And it just, the mental health stats, all of them go down, depression goes down. I don't remember them, like I said, I usually have a slide in front of me, but I don't remember off the top of my head, but depression stats go down, anxiety stats go down, and then suicide attempts go down massively for things like that, so.
Absolutely. Tori, can you talk a little bit about intersectionality and how certain aspects of your identity impact other aspects?
I mean, which I appreciate the intersectionality question. And, you know, I show up as trans, but also as a parent. I've got an almost 17-year-old daughter that's a wrestler at Olathe North, and a great son that's, I'd rather talk more about my kids than I would my trans identity. And I think that that's the biggest thing of this, is that I spend all my time in Topeka or, you know, on Zoom talking about being trans when I'd rather just talk about, you know, my kid PR'd yesterday in the 100. And that's really what I care more about. And their 4x1 just broke the school record. That was pretty cool. And can we talk about that? But the reality is we're talking about SB 233 or HB 2791 or HB 2792 or the 50 bills we have in Missouri. And so it gets lost in that. And so the intersectionality is sometimes that's all that people see. You know, I'm not blessed, and I know that the therapist and the other people in the audience, like, I don't have passing privilege. Sucks. I'm built like a middle linebacker at a really bad JUCO. And so, which is kind of unfortunate at times, but I am who I am, and this is who I am. And so I get to work with wonderful physicians and wonderful data analysts. And so many of my teammates are here right now. I'm going to try not to cry. But my intersectionality is I get to show up as all of those. I get to belong. I get to be who I am. And you know, at the culture of that, the culture of belonging is showing up with your authentic ass self. And that's what that's about. And for me, my place in where I work and the people I work with allow me to do that. And that intersectionality is, I show up with every bit of me. But the nice thing is there, I don't have to explain those parts of me and piece those away. But in the State House, I have to fight for those pieces. And that's really frustrating. And whether that's working with a physician, working with amazing lawmakers, you know, that see all of me and who I am. And I'm just grateful for all of you because I can be who I am because of you and because of this community.
Wonderful answer, my goodness. Before I ask the next question, I'm going to ask that if you have a question, you raise your hand and Carrie can bring the mic to you. So I'll ask this question and then we can start opening it up to the audience as well. So AJ, given your work leading our gender-affirming care groups, can you speak of the importance of mental health and having a community when receiving gender-affirming care?
Whew. I feel very privileged, one, to just be here. And before I say much else, I do want folks to know that while I have a queer identity, I am a cisgender male. And so that position and where my voice is coming from, my experiences are coming from, is housed in that. So I just want to be clear with folks there. I adore the work that I get to do at Burt Nash, and I'm not getting paid to say that. So that's pretty cool. Being a therapist has been a dream. It's lovely to realize portions of that. Part of that work has been facilitating a couple of groups. I've got one group that centers around sexual orientation, another around gender identity and expression. And as far as community, that's the most common topic that folks bring up. And it's not quite at 100%, but almost always when someone is coming to the group for the first time and we talk about, we have introductions and tell us a bit about yourself and pronouns and what you're hoping to get from the group, and connecting with other people, getting to know other folks, having some kind of connection, especially after going through COVID. And I've heard like the term post-COVID. I don't know that, can we say post-COVID? Are we still in it? I don't think that collectively we've bounced back completely from that. And so isolation is still rampant. And I've just myself, a mostly functioning adult. I also struggle with community and connection. And so that finding community and spending time around folks who just have an understanding, a deep connection to what it is to live and the struggles and the pressures, the difficulty to just be, right? I can't assign a value to that. It's really invaluable.
Well, if you have a question, feel free to raise your hand and Carrie can bring the mic to you.
We did see the transformation of two senators yesterday who somehow realized what they were doing and did the right thing. Is there a way to start a conversation with the other side that they can start to understand that this is a matter of health care, this is a matter of mental health care, that this isn't just, I think, the overfocus on genitalia, personally. But to know, to get them to understand, these are kids' lives. This is mental health care, and this is something that needs to be addressed. Do you know how to open the door or how to crack the surface? Because it worked for 2 of them. Can we get more, is my question. Which is a huge question, I know.
I'll speak a little bit to this, and then I might kick it to AJ. The extra 2 down, AJ. If you don't mind me putting you on the spot, but
Sure.
I think certainly I think all of us would agree that there is value in having these types of value-based conversations with people, because a lot of the rhetoric around trans people, trans lives, trans bodies right now is rooted in disinformation, fear-mongering, political gamesmanship, and not really in the actual factual issues of the day. That's not unique to the trans issue, I think, in this moment, but that is very true for what we're talking about. And there are parts of this that are, super complicated, because we see national interest groups pushing these bills. And so there may be well-meaning local state representatives who don't actually understand what they are doing when they are backing these things. There may be some representatives who fully understand what they are doing and want that to happen. I think there's a wide range, but what we saw occur was that there is wiggle room, no matter what people are saying, their party lines may be, because this is really an issue about government overreach and Kansas families and their rights between them and their medical providers. And I think that is the values that resonate across political lines in Kansas. And so we certainly do a lot of work. I'm sure folks on this panel have done lots of work. The one thing I'm thinking of is there's a number of advocates doing this work. Anecdotally, I can talk about, we had a number of medical and mental health providers come to the Capitol to have one-on-one conversations with representatives that maybe feel less comfortable in rooms with impacted community members, but feel more comfortable hearing from medical professionals or organization heads or things like that. And so if you want to talk a little bit about your experiences doing that, Dr. Strickland.
Yeah, so I had a lot of really wonderful conversations at the State House with very unlikely individuals where I didn't necessarily expect to have these conversations. And it's important to remember that a lot of times folks are acting from just a misguided place of feeling like they're trying to help, right? And that's usually the case, not in every case. I'll make that pretty clear also. Not everyone has the same value system that we have. Like your question, how do we align with those values to help them see our values? And sometimes that's possible just through great conversations, and many of these individuals don't have any personal ties to the LGBTQ community. They don't necessarily have those personal stories, which we know impact votes, as opposed to, unfortunately, logic and evidence-based science don't always have that impact as much as stories and telling your personal truths do. Those individuals, kind of like, like we've always seen, people tend to believe one thing until it's their kid, right? Until it's something that they personally have to struggle with and make those decisions. And I think the more vocal that we are about sharing those experiences from a place of, we all do really want to help these kids. And many of the votes that didn't go in the direction we wanted came from a place of them wanting to help kids. They just don't yet fully understand the impact that these votes have and how they feel like they're helping kids that they don't fully understand. And so I had a lot of very great conversations with those individuals where they said that. I mean, they said that. They don't necessarily understand. And there's a lot of political motives to voting one way or the other based on even that may have gone against their own personal views. But sitting down and just having those conversations, trying to put our like, for me as a physician, I tell them, my horse in this race is just taking care of people. And this is the best way to take care of them. And if the evidence shows that there's some other way, some other medication or some other type of treatment I can do that helps, I'm going to do that too. It's not about for me, it's not about any kind of personal or political motivation. It's what's the best way to help people, whether that's kids or adults. And I think that kind of compassion and understanding resonates with people. And I find that when people get to have those personal experiences, it changes. And as it becomes more and more common in the, the non-political arena, I mean, just look at how having, mainstream gay characters in primetime TV has come just for people, my people, right, from rural Kansas, who less than one generation ago would have had very similar feelings about the gay community. And so some of them see those parallels and start to come along, and I think that goes a long way when they start to say, now it's my kid or my friend's kid, and they can start to make those personal decisions rather than rash, archetypal decisions.
Thank you both. We have some more audience questions.
Hello, I work in healthcare. I'm a healthcare professional. And something that I've been kind of butting my head against recently is trying to get organizations to take seriously staff education. So I work like inpatient, I work on an ICU. We don't provide HRT on a regular basis, for example. And a lot of family medicine clinics also don't, because they don't have a large number of trans patients, chicken egg, right? But my question is, healthcare is fraught right now, talking about a COVID, post-COVID world, like we're financially strapped, we're understaffed, we're all stressed out. At the same time, we've been having a long-term healthcare crisis within the queer and trans communities that's still existing, it's still going on. And I don't know how to convince my organization to take it seriously. Like we talk about how we don't have elders. Our elders didn't have healthcare. And that's not the only reason, but it's one of the reasons. And so I'm curious, we talked a little bit about the legal side, but then looking at the medical side, encouraging physicians to do continuing education, but also other staff members, and encouraging organizations to sponsor and promote that kind of education.
I'll fill that one. So, as someone that has been working with healthcare for 20 years and seeing it, I was in a critical access hospital in Goodland, Kansas, trying to move that needle, a little different than LMH Health or a little different than Olathe Health. And so it takes a long time, but part of that is that getting that buy-in from your administration, from your other people top down and bottom up. And it takes time. And that's the frustrating thing, is because we know the harm historically that we've experienced, that you have experienced. And it's hard from the discrimination standpoint is that it's hard to convince somebody that there is active harm going on in the care of individuals. I mean, we look at the data, we have 128,900 LGBTQ people in the state of Kansas, per the December 2023 data from Williams Healthcare Institute. Then you look at, the trans side of that, and you look at, we have 14,500 trans people that are here in the state of Kansas. Now, those are 2-year-old estimates, but that's 2,100 youth aged 13 to 17. And so that 12,400 adults, I care more about elder trans because I'm getting closer to that at 44. And I'm like, oh crap, now what? But then you see data that says that 75% of elder LGBTQ people go back in the closet as they age. Well, you think about it, we're really good at the Healthcare Equality Index, and we index all of this, and we work really hard at healthcare. And to your point, not hard enough, but then we go and what are we doing for nursing care? What are we doing for those? In those facilities. And I'm like, well, I won't tell you what I'm thinking, but I'm like, I hope I don't go there because I'm deathly afraid of what care might look like. Because that continuity of care from birth to death, I feel pretty good now. I'm taken care of by some wonderful physicians that are in the room right now with us. It's that later and that education. And so it has to be more than just medical school and nursing school and facilities and all that. So it's across. And to your point, thank you for advocating for education. And I appreciate you. And you've done that since day one. And we've got to do better. And we got to keep screaming louder. Because we have harm that goes on at all facilities. And even those that put a badge up that says, we've achieved something, 100%, there's still harm going on at those facilities. And so that's where that trauma-informed care, and not just once, it's a perishable skill set. It has to be continual. You will forget it. It's like, when you learn about cultural humility and you learn about implicit bias, you can't learn it once and then I got it, I'm a professional. You know, I don't want you doing one procedure and like, I've got it, it's perfected, like, we're good. I'm like, what's your number? I want to know how many you've done, and I hope it's a lot. And so the same thing with the things we're doing in education. It can't be, hey, we had that one really good video, I hope you watched it. We did it on onboarding when you started 14 years ago. And I hope you take all those points to heart, and let's make sure we put data into action. And so, and it's hard, but we have to keep advocating. We have to keep trying. And it can't just be me, and it can't be you, and it can't be the ones that are like, hi, N equals 1 over here. I'd really like if you could do something to reduce harm to my community. We need people advocating for like, ooh, you know what we should do? We should make sure that across the board we're doing more education. And like Jay and what they did for Bert Nash, I mean, that's exactly what it takes. And I know that DC does so much, and I'm just meeting other AJ, but Dr. Strickland and the work that he does, I mean, it's just that constant building of relationships and friendships and conversations. And then how many panels have we been on? How many times have we talked? Man, I've done a lot of Zooms, and I was joking out there that it's like I need a John Deere tractor of how many hours I've logged on Zoom. I'm like, I'm at 3,000 hours, but that's what it takes, if that's what it takes to reduce harm.
And to build on that also, this isn't a fix-all, but every formal complaint through a hospital system has to be handled by committee. So formal complaints do get seen. Whether or not there's action, that's another thing, but having people who experience negative outcomes or perceive negative outcomes filing real formal complaints and not just letting it go does get that in front of people who do like to have immediate solutions like training to be done. Whether or not that needs to be, that needs to be done over and over and over again, but it does help result in that kind of formal hospital system, which other workplaces may not have. That could be a result of that, as opposed to, grassroots bottom-up encouragement. Formal complaints should result in some real follow-through within a hospital system, because they have to be addressed legally.
The only thing I'll add here is just I want to make 2 points. One is like Tori already kind of acknowledged this, but I just want to put a point to it is like what we're talking about, especially if you're in the community that you're wanting to address the problems of, is labor that you're unpaid for, and it's also like it's physical labor and emotional labor, and I want to acknowledge that like what Tori's talking about is like, I guess part of this is your job, but like a lot of this is like not our jobs, and it's beyond what our jobs are to do it. And so I want to acknowledge like this is labor we do not have to do that we're taking on to improve the space we're in. The other thing I want to note is like what you were talking about earlier about bringing your full self to a space and interdisciplinary approaches to our work, and or not interdisciplinary, intersectional, too many academic panels. Intersectional approaches to our work. And if we are always bringing that type of approach to our work, then I'm making my workplace better for my Black and Brown colleagues. I'm making my workplace better for my colleagues who are parents, just like they're making our workplace better for me, their trans colleague. And so that's when the intersectionality is really important, because that also helps with the burnout of the extra labor if we are all collectively doing these things. And so that's what I'm talking about when it's not just the community that needs to be doing little a advocacy, it's all of us, and it's not just for LGBTQ folks, because this is gonna help everyone. Improved CLEs, better competency, better staff, it's not just gonna help our community, it's gonna help the whole space that we're in.
So to kind of build off the question that was just addressed with educating current healthcare providers, you mentioned specifically, Tori, that you see a lot of statistical older people go back into the closet, change. Coming from healthcare myself, dealing with Medicare and Medicaid, being able to find providers is, I think, the biggest struggle that they have out there. There's so few. And do you see changes coming with the providers, or is that something we need to be helping our youth right now know that they can go on to these careers and be there?
I'm counting the number of physicians I'm seeing in the room right now. There's 1, 2, 3. Who else am I missing? I got 3, 4. Sorry, you were my baseline there. And so the fact that they're showing up here to engage in conversation and dialogue, a resounding yes, it's going to get better. And these are my people here. These are the people I text, these are the people I cry to, these are the people I ask questions to, these are the people I learn from, and we co-learn together. And so I do believe it is. Because here's the thing, each one of us one person, but they have an incredible circle, as Dr. Strickland, as does Dr. Harris. You know, all of you have an incredible circle, and that circle of influence to be able to teach other providers. And I've seen that with Dr. Bloom and her colleagues, that people that are like, you know, who does gender affirming healthcare? And you know, you get those hands coming up, and then we got more, and then we got some more, and we're like, okay, that's how it goes. Is that I didn't influence that, they did. And so it absolutely is getting better. And it's slow because the second you put physicians on a list, we know how that goes. You get those phone calls or worse. Yeah. And it's hard because, you know, you want to be visible but not too visible. And so you kind of play that game, unfortunately, with the way it is. But yeah, I think it is getting better. And it's just going to take time. And it's going to take, you know, the big A, advocacy. It's going to take a lot of community and a lot of organizing. And we'll get there. I really believe that.
Just in my short career, you know, although I look like I graduated med school yesterday, I've been practicing for almost 10 years. But when I went through my medical school and residency, there was virtually zero, I would say zero education on any significant LGBTQ issue at all, even through residency, which puts us through 2014, okay? I have a lot of colleagues that work within the academic circles of training the next generation of doctors, and I don't know of any programs in the state that don't have a dedicated LGBTQ program now. And almost every academic center has their own LGBTQ specified clinic. Now I think I would prefer to see it integrated into everybody's clinic, but that is a huge step in a very short period of time. That I think that there is remarkable progress compared to, you know, addressing other things. I think there's some real good motion going on that more so than I would even expect. So I think the future looks bright.
And there's great online resources too for our physicians, right? It's not just going to a paid CME or continuing medical education. It's Fenway Health and the National LGBTQIA Health Education Resource Center. It's these, you know, next in June, I gotta say June next month now, we're in May, I'm teaching at CU School of Medicine as Anschutz, and so I'm teaching an hour lecture there, and at Virginia, University of Virginia School of Medicine. And so it's just this collection of people that are just sharing their knowledge, their lived experience, and you get these students that, you know, one of my other good friends, Dr. Beth Aller, she's in a rural community of 1,200 people in Stockton, Kansas, you know, and as she presents with the DNP students, MSN students, the BSN students, I think I got all the letters in there, at Fort Hays State University, and it's just that, and it touches whether it's, you know, your freshman nursing or sophomore nursing students, all the way through your medical physicians or your students that are in residency, you know, those that are in PGY 1 and 2 and 3. And so addressing all of those, there is education that's going on, and I do believe it will happen. So. Mm-hmm. Oh, I forgot Dr. Holman too, I'm sorry. I missed you over there.
Right.
Oh, sorry. I'm not, I hate to be Debbie Downer, but the political committee that has helped all these states generate these bills, they just keep coming. So we defeated them this time. I get a feeling they're gonna probably come back, say, next year, the year after, and try to do this again. And they're just gonna tweak a few words and try to say the right things and get it through another time. I know that in Iowa, when the bill passed on medical care, doctors started leaving the state because they felt that their decision was malpractice or the law. And that's a tough, because they know that the right thing to do is take care of their patients' needs. what do you think will happen here or would happen? Let's hope that we can get it vetoed or not get it passed at all when it comes through again. But do you think that we would lose providers here? Or do you think that there would be another way to service the community and keep people safe?
We have a pretty tight-knit community of doctors in this state that are providing this kind of care and have a pretty, I think we're all pretty well connected, so I think we know each other pretty well. And I know there's a lot of doctors out there I probably don't know very well that are also providing this kind of care. I don't anticipate a lot of people would outflux from the state if that happened, because I think we're all pretty committed to the patients that are here. Although I could see that happening, I don't think that will necessarily be the challenge. The challenge is, how do you find solutions now in this climate? And we've been really close to that edge a couple times in the last few years, right? And people jump to action. There's wonderful people in the community that immediately started having those conversations when we get close to those. Some of them, we just have to be really, really creative and utilize all of our resources. It was a little bit easier to find those resources when we had states fairly close together, because right now we are doing that for Missouri, right? It gets a little harder. I'm licensed in both states, so I am able to be a bridge for some of those patients in Missouri. However, that will become difficult. We'll just have to find novel solutions, but I think most of the doctors doing this work are pretty dedicated to staying here. There's room in Kansas for the gender diverse community, and we want to make sure it stays that way.
Thank you. This question is for all the panelists. What is the best thing family members and friends can do to support someone who is receiving gender-affirming care at any level?
Sure. Basically, be an affirming person and educate yourself and listen to all of the gushing and the excitement of every new, if they're moving from, like for me, whenever I first took testosterone, every hair is exciting. And it becomes the most narcissistic time of your life. And family members have to deal with that. But yeah, I think it's a lot about being someone who is, I hope that just like everybody else has said, it's like, can't we just be affirming of everyone all the time? So being an affirming person for your family is being an affirming person, whether they're going through HRT or whether they're deciding to change their name or whether they just broke the record in track, right? That is to make, and sometimes I think if somebody is transitioning or they're in that inquiry, then it's also about creating space for them to be able to have those conversations and be heard, and with complete, if there is any, people are humans are like this. When we're scared or when we're freaked about something, we sense other people's, we have neuroception enough to know how other people feel about it. So to make sure that you're dealing with all of your stuff, and I coach parents a lot, and I coach grandparents a lot, you go deal with your therapist, you go deal with your stuff with your therapist, don't work it out on your kid, right? So it's this is a time for you to be affirming and celebratory and there for them and listening to them. But if you have stuff you have to work out, go work it out with your therapist or your friends, or make sure that it doesn't become their problem. And that's the biggest thing, I think, is we just have to make sure, because I think it is, and maybe it's because I'm older than everybody here, a lot, but I've been out since 1985. So, I've been out a long time, and I think it's silly for us to think that people, that for people that this is new to, that they don't also deserve the grace to have to deal with it sometimes, right? People who I went to high school with all the way from kindergarten to high school, when they meet me as Jay, as opposed to my dead name was Janet, that they went to high school with, I think they deserve a double take. I don't expect everybody to be like, wow, you transitioned? That's so cool. Tell me all about it, right? Like, that doesn't happen. And so I think it's also important for us sometimes to give our family members and give our community some grace and let them have their process too, right? So I think, and that's why it takes a village. But if you've got people going through this, then you just got to listen, be affirming, affirming, affirming. And if there's anything for you to deal with, don't make it their problem, right? Take it to somewhere else. Go have a glass of wine with your best friend and cry about it, but not to your kid. Because it can be so intense to have to share this stuff that if you're met with any resistance at all, we feel it like a scared dog can feel when you're scared, right? We can feel that. So just to manage yourself, and then affirm, affirm, affirm.
As a physician, I would say one of the biggest contrasts I see when I'm taking care of patients is whether or not they have that community or space to explore. People who don't have that can really struggle. Like, if you're just somebody trying to help your family member, friend, patient, whichever, just giving people the space and time to express themselves and explore that, even if you're just their sounding board for themselves, I think is a really critical step. Just being there to listen and not just start assuming, just listen.
Yeah, one of the things that I hear the most from parents is that fear that what if they do, and you've all heard this, and with the kids, what if they do something permanent, right? What if they do something to themselves that's permanent, right? And it's like, I don't know. What if they do? But what's important is like if we don't resist, right? Because what we resist persists. If we don't push against it and we let people be curious and have that space, then I've never met people, I've known people who've gone on and off testosterone and on and off estrogen, and people land where they are supposed to land. And if we don't resist it, we don't push at it, then they have the grace to do that, then it always turns out to be this beautiful dance that they never regret. I've never had anybody I know that's gone on testosterone, off testosterone, on testosterone, off, on estrogen, whatever, all the things have regret. Like, it's our lives, it's our dance. And when we're allowed to get curious, I also know people who have started out to think they wanted to transition and then decided not to. And they had the space to figure that out for themselves and not get locked into that. So yeah, that's a great point.
I think the only thing I'll add is, you kind of touched on this, Dr. Trick, but like just not assuming. I think that don't assume like your kids or your friends or the people in your life know how you feel about this issue. Like, you live your life and you have these values, and so maybe you think like people assume that you're an ally or that you are a safe person or that your kids have parents that would affirm them. But even if you are in a city like Lawrence and you're raised in a community that like is fairly welcoming to queer and trans folks, we are still like raised in the world that we live in. Our state can be conservative depending on like the various like family cultures that people are being brought up in. There's a lot that they're hearing that makes them afraid or scared to even want to open the door to explore, because they have only heard messages of explicit shame and fear and guilt, and they haven't heard explicit messages of love, or not even love, but just like indifference, like just normalizing the conversation. And so if it's something that you feel confident that people know about you, but you haven't done things in your life to make it clear, change your work environment so it's clear that you have some pride symbols or something, or you don't verbalize these things. Think about the ways that you are making it explicit that you are a safe person for this community, and don't make that an assumption.
Jay, or I guess any of the other panelists, are there local support groups that you're aware of, particularly for children, but also for adults in Douglas County?
Here in Lawrence, we have the Rainbow Kids and Families group, which is for kids 12 and under. My big concern is the 13 to 18, because last I knew, Bert Nash people would have to tell me this, we don't have a support group for teens. So, because you've got your groups, AJ has his groups for the adults, but I don't think we have any support groups for teens that I know of.
There's currently a talk right now, sorry to interrupt.
No, that's what I've heard.
Yeah, our Children and Families wing of therapists are courting to hopefully launch
Good.
a group for kiddos.
Yeah, that's what I was told
Yeah.
too, it could be on the way. So, and then we used to have like a LGBTQ social group almost. It was run by, when I first moved here, but that hasn't been in existence for a really long time. So, yeah.
Kansas City has a few, but that's a ways for a person that age.
Yeah. I mean, every school, every one of our middle schools, when I first moved here, we didn't have GSAs in every middle school. We only had them in high schools. Now we have a GSA, which used to be called Gay Straight Alliances. I don't even know what they're called anymore. I'm sorry if I'm saying it
Still
wrong.
haven't updated it.
Because, I mean, I know,
I ask
I'm like,
this all the time in my talks. I say,
I don't know.
GSA, and then-
It might be the wrong words, because who knows? But we have one in every junior high. What's interesting, though, is now, and talk about, like, I have been sitting on these panels for 35 years. So, trust, things have gotten way better. There weren't people out. When I was 18 years old in 1985, people were like, oh, you're out at 18? Like that was big to be out when you're 18 in 1985. Now kids come out when they're 10, so I mean, it's so different. But when I first moved here, we didn't have GSAs, but what's weird about GSAs now is at least being a gay or lesbian or pansexual kiddo, they don't even feel like they need a queer group, some of them. You know what I mean? It's like it's not as big of a thing as, it's not, the GSAs are not as vitally necessary as they used to be, which tells you how much we're moving in the direction of belonging and creating belonging inside of our community, even outside of the little group. Does that make sense? Yeah.
I believe it was 2021, the House of McCoy was launched, so that's an organization supporting queer and trans youth of color here in Lawrence.
That doesn't exist
Oh,
here now.
okay, well, scratch that.
Nope.
What I can
Things
share
change
that
fast.
I know is still running. Gosh, young folks are great at networking and communicating with each other and finding ways to connect. I hear a lot from members in my therapy group connecting over social media. There's currently a group on Discord for older folks like me. That's another way young folks communicate, but of all ages really. This particular group, last I heard, has like over 200 members, and they try on like Saturday mornings to get together somewhere here in town. Usually connect over, in a coffee shop. They might go somewhere else after that, and I believe that's growing. So that's certainly something to look forward to.
And I think, so the one in Kansas City, I'm thinking of Kansas City Center for Inclusion, and I think they have an online meeting that includes teens, but I'd have to double check that. I'm sure it's on their website.
And then just locally, this is like more informal, but to Jay's point, I know Lawrence Pride has started to do more LGBTQ social nights. Some of them are family nights. They've been doing, it's like gay bowling, or I'm not sure what it's called, but they've been doing some more kind of like community events. And then also the Trans Lawrence Coalition kind of formed out of advocacy around the No SB 180 campaign, has started to do some more community events and are trying to have those be opportunities to have family-oriented events that are like daytime and not all like drag replay nights. But so I know that there is a bit of that kind of bubbling in that space as well. And there's drag replay nights for the people that want those.
Yeah, for those of you who can stay up past 10.
I know. They pushed it to a 9 start, which is a gay 10.
That's
so.
my bedtime.
Do we have any more audience questions? Okay, to go with that. Ooh.
Dr. Harris.
I have a question, I was just gonna add that. I was just gonna say Rainbow Kids and Family we don't discriminate. We'll take the older teens too.
Okay, good to know.
In-person group, like everybody is, I think the last one we had was at the library here, of course. And we had like
Oh, good, good, good,
No,
good.
I'm 16, and so my kid's usually here too, so we have anybody.
Awesome, that's great for me to know.
Thank you.
Yeah, thank you.
AJ, how can Douglas County community members find a gender-affirming therapist? We talked about the physical healthcare side of things, but that side.
I wish I could say that there was a very reliable, up-to-date, centralized tool to use. We're not quite there yet, at least unless I'm outdated on that one too. It's possible, but I think there's a lot of grassroots conversations that occur. So folks who are connecting with friends or other professionals that they might have connections, peers that have had a good experience with a therapist or psychiatrist, and sharing that with each other. I mentioned the networking before, but I think there's it has to be possible to contact, Burt Nash or Heartland, organizations that do provide those services, and use that as a starting point to then have conversations with folks who are there, anybody working there that tends to work with these populations or has some expertise, some training in these areas as well. But returning back to that grassroots networking, that word of mouth, I think that's still the most effective and most successful way to find someone.
I will chime in that, like, we were mentioning the Discord space or like the LGBTQ Kansas Facebook pages, or there's a local Lawrence one. I think that's how I found Dr. Strickland, was like crowdsourcing with the community. And I know a number of my, friends that are parents that were looking for their children have used those type of local support groups for just sounding boards in lieu of what is hopefully going to be a more robust network of competent therapists that we have, like, accessible in an easier way. But that has been pretty reliable, I think, in a lot of my friends' spaces.
Yeah, I'll add too, I tend to lean toward talking to people that you trust, just because of the age of misinformation that we're living in. Like, for example, there are websites where you can search for therapists, and this isn't unique to just Lawrence or unique to Kansas, but as a clinician, I could go on there and I could just click on a bunch of boxes, or I could list out a bunch of things that I'm an expert in when I'm not. So there are a number of folks out there that maybe to try and increase their caseload or whatever the motivation is, they might be selecting that they're professionals around gender affirming care, but really they have no training. Not to inject fear, but just being realistic in that there's information out there that might not be the most accurate. So
Yeah, definitely put more effort into finding a good therapist and a good doctor than you do on reviewing your plumber's Yelp results. Yeah, I tell patients that all the time because it seems like nobody ever seems to really do any kind of research into who their doctors are that they're going to go see. Like, just go to urgent care or whatever. It's like, if you want good care, you need to do a little bit more of a deep dive into the care you're going to get than just one review. So.
There are organizations, in terms of OutCare Health, full disclosure, I was a board member there for 2 years and ended last year. I got nothing from that, but other than a great experience. So I just want to make sure I have my disclosure statement there. But we're aiming for 5,000 providers on there, and there's 50,000 unique visits per month on people that are searching on OutCare Health. And there's the Wichita LGBTQ Health Coalition that has a directory. And there's there's number directory, but none of them are all coming together. There's always this, and as a patient, it's hard. You're like, when you're on Reddit looking for a doctor, that's a challenge. And so you're like, how'd your Twitter search go? I found a fantastic physician, Dr. Strickland's great. But that's how it is, unfortunately, looking at our healthcare sometimes, because there is so much harm in its word of mouth. But there are some directors out there that they're like, and you see his name on there 3 times, you're like, it's got to be good. And so that's kind of how we search for healthcare sometimes. And also checking your ego and logo at the door. There's no logo agnostic directories in Lawrence on trying to find things. And that's been something that we really try towards, or there once was and hasn't been updated, and half the physicians and therapists leave. And how do we do that sustainability and maintenance of that, and kind of have that coalition together here?
Thank you. Do we have any more audience questions? Okay. Before we go, I was going to ask if each panelist could tell your younger self one thing about the world that we're in, or give yourself some type of hope. What would it be?
How long can we process the question?
I feel prepared because I watch RuPaul, and so I have often thought about what I would tell the picture of my younger self on the stage when they have their drag king season. For folks that don't know about it, just ignore all of what I just said. But I think I'm feeling hopeful in this moment. I think because of what we were talking about at the beginning of this evening, what Kansas was able to do for trans youth in our state this week. And so I think looking back at little me growing up in Kansas, I don't know, I think I was scared to make this be my home. I had a gay aunt that fled to California, and that was kind of my exposure to what it meant to be queer in Kansas. I didn't know you could be trans in Kansas. And in the moment I'm in now, which is I'm on this panel with amazing folks that have been doing work in Kansas since I was that kid, and have a room of people that are medical providers and mental health providers and community members that care about the trans people in the city that I'm, have chose to make my home. I think, I don't know if I have a salient point, but just I'm really full of hope and joy for the life that I get to have in Kansas, and for the life that all the trans kids in our state get to have. And I know that we have a lot of work to keep doing to make that Kansas exist, but I believe this week that it will exist.
I think for myself, I would have encouraged my younger self to take the leap to start making a difference earlier, instead of spending so much of my career pushing back against things that I couldn't necessarily make a big difference on. Our healthcare system doesn't work very well. I know that's news to everyone. And you can spend a lot of energy, a lot of emotional and physical energy, and years of your life pushing to try to fix something that other people don't want to fix, who have more power than you to do that. And whereas I think I would have encouraged myself to just take the leap and start making a difference with the things that I could at a younger age. Just the little changes start to snowball really fast, and you lose a lot of time. The time goes fast, that's all.
Well, you didn't provide tissues, so we'll see how this goes. Talking to younger me, it would be that it gets better, that you get to breathe, and that you get to be comfortable in your own skin, and that you don't have to apologize for who you are and be shameful and embarrassed and feel like you're not good enough, and then you have to keep running from who you are. And I think it's that ability to find your community and find your people and just get to show up embarrassingly as you are, but be proud and have people accept you for who you are, because I never thought that was possible at that age. And to be able to look at younger me and say thank you for being so strong, and thank you for sticking with it in Dodge City, Kansas. That was a good time. And I made it to Lawrence finally. And so, because it does get a lot better here than Western Kansas, I'm not gonna lie. So, and I came out as trans in Goodland, also an interesting experience. 3 stoplights when we only needed 1. And so that, even not long ago me, it gets better. And I think that that's the thing, is just that persistence, that grit, that resilience, and that I was strong enough at a young age when I was 6, 7, 10, and just wondering if there was any hope for me. There is. And the future is so much better.
I'm gonna hop in before Jay. I think maybe a bit tongue-in-cheek, I would tell my younger self that adults don't know near as much as you think they do. And there's meaning in your voice. There's meaning in your perspective.
Oh, okay. Wow, God, this is so hard. So if you know my story, you know I was a suicidal youth, and so all the things that Tori just said, and then, seriously, other than that, I would go back and high five myself for coming out and being as out and loud and as obnoxious about being queer as I have been since 1985. And I would really, really, really encourage myself to buy property in East Lawrence before 1995. I'm not kidding about that at all. That's the truth.
Thank you all so much. Thank you for your vulnerability on this topic and sharing your experiences. I truly appreciate each and every one of you for being here tonight. Before we go, we just have some closing remarks from Patrick Schmitz, our CEO.
Thank you, Robin. Patrick Schmitz, him, CEO of Burt Nash now for just coming up on 7 years. First, thank you all for coming tonight and sharing your personal and professional experience, your strength, hope, and everything that you've provided for us tonight. Thank you for coming out and doing that. Thank you for Merit Trust Credit Union for sponsoring our series and for creating an opportunity for us to gather together to hear really important topics. Gender affirming care is proper health care. It is suicide prevention. As the parent of a transgender youth, I firmly understand and experience how important this topic is and how important proper gender care, gender affirming care is. And so what was not one time my community is now part of my community. So thank you for being here and welcoming us in there. As Robin said, we are just really beginning this work. Some of you have been on this journey for many years. We've been doing it for a while now, but it's really just beginning. As many of you mentioned, we've got a long ways to go, but that can't deter us. We got to just keep moving forward and keep going. We're just proud to be a partner to many organizations who are doing this work and working to make our community better. Of course, now I got to do our shameless plug. If you're interested in learning more about Burt Nash and being involved in things, please go to our website. We have mental health first aid trainings, the opportunity to be involved in building care kits for our clients and others in our community. So please take a look at our website for those kind of opportunities. Be on the lookout for our next installment of our community education series. This will be a panel discussion for Minority Mental Health Month on June the 11th from 6 to 7:30 right back here. And thanks again to everyone for attending, and travel home safe.